Prior to having the Da Vinci system available to me, though most of what I did was done through minimally invasive means, there were still some types of procedures and some types of patients that I really couldn't do except for through a larger incision.
Well, the Da Vinci robotic surgical system has allowed us to perform a more variety of minimally invasive procedures, a little more complicated procedures. We can keep them in the area, not have to send them to other facilities.
Well, I have several friends who've had a hysterectomy in the past, and I wasn't looking forward to it when I was told that I should have one because of the length of time for recovery and the amount of pain and discomfort associated with it.
When I heard that I had to have a hysterectomy, I was so scared. I've heard people don't go back to work for 6 weeks or 3 or 4 weeks, depending on their surgery. And I was really scared, and I don't like pain. And so I told my doctor, whatever is least painful, that's what I want to do.
We're on the forefront for a smaller community hospital, but this is really the way that surgery is going, and it's the future, and we're just ahead of the curve, and I'm very appreciative that we were able to bring this technology in at this time.
I have a magnified three-dimensional view inside of a patient, which we've never had before. But the instrumentation is wristed. It moves like a human wrist, so it's intuitive. And I can do the same things I would do with my hands, but my hands are not in the patient anymore.
For our patients, because it's minimally invasive surgery, they're able to go home sooner from the hospital. They tend to have less pain. They're back in the workforce quicker.
I was in overnight. I had the procedure in the morning, and I was home by noon the next day.
I took 3 weeks off of work because I was told to expect at least 3 weeks. And after a week, I was ready to go back to work, and they wouldn't let me go back to work. So I didn't want to sit and waste all my vacation time. So I went to Seaside on the Oregon coast.
I had a prescription for pain medication, but I think I used one pill, and I think I used ibuprofen once after I got home.
We've known for a long time that minimally invasive surgery allows you a lot of things. It allows you less chance of infection, less chance of scar tissue, less chance of bleeding. All those things are things that we see as surgeons right away with this system. But the difference with the Da Vinci technology also is the pain is so much less post-operatively. Patients go home within 24 hours.
I would recommend this to anyone because of the lack of pain. And the scars are so tiny. There was just 4 little scars instead of a big incision across the abdomen. And they healed up so fast.
The amount of invasiveness is much, much less. And I think that's why there was no pain, and I think I healed faster.
A long time ago, I decided that for me, right or wrong, the best way to take care of a patient is the same way I would want my mom, my wife, or my daughter cared for. That just makes sense. So if I thought that there was a procedure that a patient could get only in a big city, I would tell her, you really need to go here. But it's 2 hours away, it's 5 hours away, and the problem with that is that it's 2 hours each way for the preoperative visit, for surgery, and for afterwards. If there's a complication, the surgeon's not here, they're far away. So what we have now through this investment by Pullman Regional Hospital, we have technology that is the same as anywhere in the world. There's nothing better anywhere. What we have here is world-class medicine, and we're giving it to a community that is small and the surrounding communities. It's allowing us to do the very best for the patient, to get her back to her life faster, the same as if she was in a major city, but she's not. She's here, where we live and can take care of her.